grossly out of order. You started heckling. You were heckling against him. You did not behave orderly yourself, Senator Cheriot. You were not orderly. You started heckling and Senator Cheriot, you started heckling and I let you. I did not bring you to order. You will now, I will.
Specific documentation that he has said that I needed to supply. This is regarding the death of a young man who was a student at Kibera Secondary. Honorable Speaker, this is regarding compensation. So I came here purposely so that I can hand these documents to the CS. I hope he's the one walking in. I hope he's the one walking in. Yeah, so if he has arrived, then we need to proceed. But these games, Waziri, they must come to an end. Because just a minute. Honorable Speaker, please allow us to speak, Majority Leader. I am on the floor. Why are you heckling us? Why are you heckling us? This is not your house. Leader, this is not your house.
Majority
it is the house
Leader.
For all of us.
Majority
and the
Leader.
information that we have comes from the Speaker.
Majority Leader.
You can't heckle us all the time. Can
Majority
you throw him
Leader.
out? Honorable
Majority
Speaker.
Leader. Order. Order.
Order.
Order.
No,
Order.
Honorable Speaker,
Order.
this is unacceptable.
Order, Senator.
Even if I was asked to be nicer, I will not allow this provocation to continue.
You started heckling. Okay, then let's stop it at there. Let him finish and listen to him in silence.
Speaker,
yes, Senator Sifuna.
Honorable Speaker, how is it in order for somebody who's younger than me to call himself my elder? We in which society? And in this particular house, Honorable Speaker, there is nothing like seniority coming from how old you are. It is what is in your brain. It is what is in your head. So you can't come here heckling and telling us you are senior to us, Honorable Cheriot. You are just lucky that I have been directed to be nice. Otherwise, you would have seen the full wrath of Edwin Sifuna. Honorable Speaker, I want these demons who have been sent to tempt me to break the directive by my party leader to depart from me. Leave me alone. Honorable Speaker, therefore, now that I have seen the CS, I will take my seat because it was very critical. But as Senator Wambua has said, the communication to this house
He was on the floor of the house.
Yeah,
Can you
please
allow him to finish? Senator
can you throw
Cheriot.
this guy out? Is
Senator
Senator Cheriot above the law? Is Senator Cheriot above the law, Honorable Speaker?
Order, senators.
He can't heckle like this.
Order, senators.
He can't heckle like this.
Order, senators. Order. He's addressing his issue now. Can we allow him to finish? Let's listen to the senator in silence. Senator Sifuna, just conclude.
Honorable Speaker, it is very unfair. If it was Senator Sifuna behaving like this heckler from Kericho, I would have been thrown out by now. I would have been thrown out by now. Can you apply the rules equally? No, apply the rules equally. Honorable Speaker, I wanted to say lastly, no, throw him out, Bwana. One is he above the law? He's not above the law. You are not above the law, Senator Cheriot. No.
Senator Sifuna.
Let me conclude.
Before you conclude, there's a point of order. Before you conclude, Senator Cheriot, what is your point of order?
How can somebody who is out of order be given a point of order? He is already out of order. How can he stand up unless the point of order is against himself?
Honorable senators. Senator Cheriot, take your seat.
I thought we have senators here.
Take your seat, Senator. Take order, senators. Order, senators. Senators. The CS is already here. We are going to go to and proceed to question time. And we will seize, we will not, Senator Cheriot, take your seat. Take your seat, Senator. Take your seat. Senator Cheriot, I will find you grossly out of order. You started heckling. You were heckling against him. You did not behave orderly yourself, Senator Cheriot. You were not orderly. You started heckling and Senator Cheriot, you started heckling and I let you. I did not bring you to order. You will now, I will find you grossly out of order. All the time when Senator I was going to give you a point of order so that you can respond, but you were not behaving orderly. So I have to put a stop to this, and we go to question times. That is it, senators. We are starting with the questions. Honorable senators, honorable senators. Senator Cherargei, what's your point of order?
Mr. Speaker, I was requesting understanding on the number 1 and standing on the 101. You heard Senator Sifuna say it's heckler. Can it be expunged from the record of the House so that we protect the dignity of the member, Mr. Speaker? That's my indulgence. No, Mr. Speaker, you need to rein on Senator Sifuna. He cannot be heckling everybody. He needs to behave. Yes. Can you kindly, Mr. Speaker?
Senator Sifuna, order.
Mr. Speaker.
Order.
Mr. Speaker, understanding order number 1, can you kindly expunge the word referring Senator Cheriot as a heckler? That's what you are just requesting. Then the matter rests there.
Honorable senators, I want to bring this matter to an end. Yes, I did, for a matter of fact, I did not refer to Senator Cheriot as a heckler. I said he was heckling in the House. But Senator Sifuna, you did refer to the senator as a heckler, which is out of order. If you could withdraw that and apologize.
Honorable Speaker, you are determined to turn me back into the old me. You yourself have said he was heckling. A person who heckles is a heckler. That is what you call him. Senator Cheriot of Kericho was heckling me. He's a heckler. You yourself have made that decision. I will not allow anyone to bully me in this House. I did not come here because of Cheriot's graces. I was elected by the people of Nairobi. He's not bigger than anyone in this House.
Senator Sifuna.
If you cannot throw Senator Cheriot out for the misbehavior, then there are no rules in this House. There are no rules in this House.
What's your point of order, Senator Cherargei? Give him the mic.
Mr. Speaker, Mr. Speaker, Mr. Speaker, Mr. Speaker, Mr. Speaker, you cannot allow, Mr. Speaker, you cannot, Mr. Speaker, you cannot allow the House to be overrun. You are in charge. Mr. Speaker, I'm inviting you to standing order 121 and 122, which says a senator commits an act of gross disorderly conduct if the senator defies a ruling or direction of the Speaker or chairperson of committees. So Senator Sifuna is totally out of order. He must be thrown to face consequence of standing order 121 and 22 so that this House can proceed, Mr. Speaker. He has defied your direction.
Senator,
he must be thrown out.
Senator Sifuna. Senators, let us conclude this. Let us conclude. Let us conclude. Senator Sifuna. Order, senators. Senator Hamida, order. Cherargei, order. Order. Senator Sifuna, the point of order that Senator Cherargei has raised is a valid point of order. As the chair, I did direct you. Even though Senator Cheriot has said he's not even looking for you to withdraw and apologize. But as the chair, I had already given a ruling. So for the sake of sanity and so that we can proceed, just withdraw so that it does not appear that you called Senator Cheriot a heckler. Just withdraw Senator Sifuna. Senator Sifuna. Senator Sifuna, just withdraw so that we can proceed. Senator Kajwang. Yes, Senator Kajwang, what's your point of order?
Mr. Speaker, there is a reason why we want to position ourselves as the upper house. The CS for Health, and allow me just 1 minute to say this, was the leader of majority in the other house. He was extremely contemptuous to this house. And we cannot conduct ourselves in a manner that affirms the kind of contempt he used to show to this house. Instead of us pointing fingers at ourselves, we should be condemning the CS for keeping us waiting. Mr. Speaker, we have had children sitting in the gallery, children that you have invited, seeing the leader of this house behaving in a manner that is beneath those children. Mr. Speaker, the initial request was to expunge certain statements from the Hansard. And Mr. Speaker, I think that is fair enough. If they can be expunged, let us not push these things of apologies because we are now getting into brittle egos, Mr. Speaker. I urge you to direct this house and to take control of this house so that we can train our guns on the cabinet secretary rather than on ourselves. Please, let this house remain the upper house. Let this house be a house of decorum.
Honorable senators. Honorable senators. Order, senators. Order. I'm not giving you to speak, Oroba. I'm not giving anybody to speak. Order, senators. Oroba, order. We are going to proceed to question time. I'm not going to take any more points of orders. Can we proceed to question number 22 by Senator Tom Ojienda? Senator Tom Ojienda, ask your question.
Thank you. Thank you, Mr. Speaker. Thank you, Mr. Speaker. Mr. Speaker, the last time we were at the funeral of the late member for Kasipul, Senator Sifuna was told to stop what is done today. But let me move. Mr. Speaker.
Order. Order, senators. Order. Order, senators.
Let me move to my question, Mr. Speaker.
Yes, put your question.
Yes. Honorable Speaker, let me move to question number 22, addressed to the Senator.
Order, senators. Order.
No.
Order. Let's listen to the question in silence.
Mr.
Senator,
Speaker,
proceed.
To ask question number 22, addressed to the CS Health. Could the Cabinet Secretary explain the terms of the engagement between personnel from the Ministry of Interior and National Administration and the Ministry of Health in the ongoing registration of Kenyans to the Social Health Insurance Fund, SHIF? 2, what are the specific roles of the personnel in the registration process, and could the Cabinet Secretary indicate if they are receiving extra incentives, and if so, state the amounts they are being paid? Part C, Mr. Speaker, of the question, could the Cabinet Secretary clarify whether the established guidelines for the operations of the personnel to ensure that vulnerable persons, particularly the poor and elderly, are not coerced or unduly influenced to register for the program? Mr. Speaker, that is part 1. Those are part 1, 2, and 3 of question number 22. Yes, I confirm receipt of the responses. Cabinet Secretary could proceed.
Cabinet Secretary, please welcome.
Thank you, Speaker, and thank you, Honorable Senators. Speaker, if you allow me, on a light touch, the Honorable Senator for Homa Bay, that I had, in my old days, I had points of legislative difference, but I had no contemptuous for the Senate. I'm a person who believes in devolution, and I have a lot of respect even now for Senate. I want to confirm that, and to all senators and members of parliament. Coming to the question by the Honorable Senator for Kisumu, Honorable Chair, the Ministry of Interior and National Coordination, through its national government administration officers, plays a vital role in coordinating national government functions at the county level. Among their key responsibilities is identification and mobilization of citizens for national and civic registration. Notably, Ngaos, as they are known, have been instrumental in advancing the implementation of the Social Health Authority, having successfully registered 12 million households during the initial phase of the rollout of the universal health coverage. As of 12th May 2025, registration stands at 22,199,252. Honorable Speaker, every day, save for Saturday and Sunday, between 40 to 50,000 Kenyans register voluntarily. Honorable Speaker, in relation to their terms of engagement, the National Government Administration officers have been responsible for the following functions. They help us coordinate UHC registration, and we leverage on the extensive network across all the 47 counties. Ngaos are spearheading the registration of Kenyans into Social Health Authority. They help us in community sensitization. They are playing a very vital role in educating communities about the transition from NHIF, defined NHIF, to SHA, addressing the misconceptions and encouraging active participation in the registration process. Honorable Speaker, they help our members. They help us in monitoring and reporting. Both at the regional and the county commissioners are tasked with the daily monitoring of registration progress and working together with the community health promoters and other health care workers. They submit regular reports to ensure that the attainment of the 12 million households target. And finally, they help us in community engagement. Ngaos are actively engaging with the communities to dispel misinformation and promote understanding of the benefits of UHC, thereby encouraging widespread participation in the registration process. Honorable Speaker, in terms of engagement strategy, by utilizing the extensive network, similar to the previous successful registration of farmers for the subsidized fertilizer program, the Social Health Authority was able to quickly reach out to Kenyans, even in remote areas, and provide them with information on how to register for the program. Still on the same question, Honorable Speaker and Senators, the Senators sought to know what are the specific roles of the personnel in the registration process and if they are receiving extra incentives. Honorable Speaker and members of the Senate, while Ngao officers are playing a critical role in the SHA transition through mobilization and sensitization of registration process, they are not receiving any additional allowances beyond their regular salaries. Their involvement is considered part of their official duties. Honorable Speaker, the government strategy is to leverage on the extensive network of Ngao to reach communities at grassroots level and educate them about the benefit of UHC. Honorable Speaker, finally on this question, the Honorable Senator for Kisumu sought clarifications on whether there are established guidelines for the operation of the personnel to ensure vulnerable persons, particularly the poor and the elderly, are not coerced or unduly influenced to register for the program. Honorable Speaker and Honorable Senators, to ensure ethical and inclusive environment, the government has established guidelines to prevent coercion or undue influence, particularly among vulnerable population. 2, the registration process is designed to be accessible and user-friendly, with various options available to the individuals. The options include the USS code registration, the online registration, the in-person registration and at designated centers, the use of the community health workers, the registration that we have created for teenage mothers, among others. Honorable Speaker and Honorable Senators, by providing multiple channels, the government aims to reach all segments of the population, including the elderly and those in remote areas. Additionally, public awareness campaigns are being conducted to educate the public about the benefits of UHC and the importance of timely registration. The Social Health Insurance Regulations 2023, and I want to thank this House for helping me through the Committee on Delegated Legislation of the Senate to articulate, that law articulates the registration process described above. Honorable Speaker, moving to question 30, sought by the Senator for Kisumu on the analysis of the financial implications and the benefits of the 3 funds under the Social Health Authority vis-à-vis the former defunct NHIF. My response is as follows. The Social Health Insurance is established under the Social Health Insurance Act of 2023, which this House has passed and which repealed the NHIF Act number 9 of 1988. The Social Health Authority, Honorable Speaker and Senators, has 3 funds, namely the
Cabinet
primary...
Secretary, sorry to stop you. Senator Professor Jenda had not asked the second question, his second question. If you could allow him to ask the question so that you can proceed.
Oh.
Thank you. But I can ask question 030. Question 30, could the Cabinet Secretary provide a comparative analysis of the financial implications and insurance package benefits of the 3 funds under SHA vis-à-vis the defunct NHIF for individuals in the formal and informal sectors? 2, what is the justification for the mandatory migration of details of NHIF contributors to SHA? And could the CS outline any measures put in place to ensure that data protection laws were not violated in the process? Part C, Mr. Speaker, could the Cabinet Secretary explain the measures put in place to guarantee comprehensive year-round health coverage for entire households to prevent depletion of insurance package benefits by individual members? And lastly, what challenges at NHIF, and this is the part that is key, necessitated the transition to SHA? And could the CS explain the rationale behind the establishment of those funds so that Kenyans can understand? Thank you, Mr. Speaker.
Proceed, Cabinet Secretary.
Sorry, Honorable Speaker, I thought I was answering the both questions asked by the Senator, 22 and 30. But let me now answer 30. The Social Health Authority is established under the Social Insurance Act 2023, which this House has passed, and which repealed the NHIF Act number 9 of 1988. The Social Health Authority has 3 funds: the Primary Health Care Fund, the Social Insurance Fund, and the Emergency Chronic and Critical Illness Fund. These funds ensure the full spectrum of health care is given attention from the point of prevention, promotion, curative, rehabilitative, and palliative care. Honorable Speaker and members, from the onset, allow me to state that in terms of access under SHA, Kenyans can access free primary care by just registering as a member. For NHIF to access any benefits, one had to register and pay monthly premiums, leaving those who have not paid with no benefits for them. And in this regard, accessibility of primary health care to all Kenyans who have registered or with registration will address up to 70% of the health burden under the universal provision of primary health care to ensure that in totality we attain full universal health coverage. Let me make it very clear, Honorable Speaker, that from level 2 to level 4 of the primary health care, Kenyans, all they need to do is to register. It's free. You can walk to any dispensary. You can walk to any health center. You can walk to any sub-county hospital. As long as you are registered with SHA, the government of Kenya, through a budgetary allocation, will pay for it. And we are working around the clock, and I will answer, I'm sure members will ask me. We are increasing the refill of KEMSA to 100% so that Kenyans need to go to these centers. And all that they need to do is, once they are treated, that facility will bill the Social Health Insurance Authority. Honorable Speaker, allow me now to highlight on the specific benefits of the 3 funds as compared to NHIF on various benefits categories provided under each fund. And let me start with the Primary Health Care Fund. In the Primary Health Care Fund, let me pick on the outpatient services. Honorable Speaker, in relation to outpatient services, SHA focuses on preventive, promotive, curative care services, and palliative care. Members are not limited and can access health services within the primary care network. There is no need to pre-select your health facility. You don't need to select. You can be in Kisumu, and the next day you are in Kakamega or in Garissa and visit any health facility as long as it's registered with the SHA. So there's no need to pre-select health facility, as the patients are free to go to any SHA-contracted facility when they fall ill in any part of our country. Comprehensive services provided include health education, diagnosis, treatment, essential laboratory investigation, basic radiology, and chronic disease management. Honorable Speaker, comparing this with the defunct NHIF, NHIF only focused on curative care. And I've said earlier, this now has changed. We care more about promotive, preventive, and rehabilitative care. So NHIF was only dealing with curative care. Access to service by the former defunct NHIF was limited to a specific choice of a facility, therefore, limiting the members or our citizens from accessing services in case they fall sick when they are away from their selected facilities or facilities of their home counties or home constituents or wards. Services are limited to 4 visits per card per year in particular facilities, and to basic services such as consultation, laboratory investigation, and only minor surgeries. That was what was in the previous NHIF. From the foregoing, Honorable Speaker and Senators, undoubtedly, the Social Health Authority offers a broader range of outpatient services with the focus on comprehensive care, making it more valuable for managing chronic conditions and preventive care. Honorable Speaker and members of the Senate, let me go to the optical services. In the respect of optical services, SHA provides a more comprehensive optical care package with a focus on preventive and corrective services, making it more beneficial for the long-term eye health management of our people. Honorable Speaker, the services will now include eye health education, eye examination, basic eye medication, and if need be, eye surgical procedures. Honorable Speaker, it is good to note that these services were not offered by the defunct NHIF, which had only 20% of our citizens. Let me go to the Social Health Insurance Fund. Inpatient, what do they provide? Under the Social Health Insurance Fund, in relation to the outpatient care, SHA provides more comprehensive inpatient care with a clear structure for different levels of facilities and longer coverage duration. Honorable Speaker and Senators, critical care service now covered includes, among others, ICU at a rate of 28,000 a night, HDU, and palliative inpatient care. The expanded coverage also include pre-admission evaluation, hospital accommodation, specialist consultation, post-discharge follow-up, and has a limit of 180 days per household. Honorable Speaker, if you compare this with the NHIF, as the member has sought, NHIF only catered for a negotiated daily rebate charge negotiated between a healthcare provider and the NHIF. The patient was nowhere found. It was between the NHIF and the healthcare provider. The NHIF also only covered treatment in government, mission, and some private hospitals, with the limited based on health categories. So the number of health facilities you can visit was limited. Let me come to maternity and neonatal care. Honorable Speaker, in respect of the maternity and neonatal care, SHA offers more inclusive maternity care, covering a wide range of service and ensuring that aftercare for both mothers and child. This package is not only limited to maternal care during pregnancy, but it covers the whole comprehensive package. Honorable Speaker, under SHA, maternity and neonatal care has now been expanded. It has an expanded scope of antenatal and postnatal care that entails how we manage complications, including critical care for both mother and the newborn. It is our moral and constitutional duty that as a country, we, using SHA, we reduce both the death, the maternal mortality of both the mother and the newborn. It has also incorporated services that were under the Linda Mama cover and enhanced it from a delivery of Kenya shillings 5,000 to a reimbursement of 10,000, which constitute about 100% increment for normal delivery and 30,000 for cesarean. Mr. Speaker, just to demonstrate, the honorable members who are members of SHA and who have an extra comprehensive insurance cover given by the Parliamentary Service Commission. The chair, for example, the speaker sitting today, his house girl or houseboy, or his house girl, for example, let me pick that, will go to Pumani Hospital, deliver 30,000 paid, and walk away without paying a cent, even for cesarean. The speaker, if he goes his wife goes to go and deliver in Aga Khan, SHA will pay 30. His other contribution, medical cover, will pay the 170, because Aga Khan is 200, Pumwani is 30. But the same speaker sitting here can also ask his wife to join his house girl to go and deliver, like the rest of Kenya, in Pumwani, and walk out with a baby. So the choice is the same. So we are caring for your house girl, but if the speaker and Speaker Kingi, let me pick on Speaker Wetangula, if they want, because of equity, they can join our Honorable Sifuna's wife, or my wife can go, I'm saying, even the president's wife can go to Pumwani and join our house girls. That is the health care, and that's why we say SHA has brought the element of equity. The choice is yours. You can go to Pumwani or you go to Aga Khan. Honorable Chair, the next question was, also it covers, as per the MOH guidelines, normal and cesarean deliveries, postnatal, and immunization for the newborn is also covered. Honorable Speaker, how do we compare this with NHIF? NHIF cover was limited to only antenatal care, postnatal care, deliveries. It also attracted co-appointment in the event of a complication of a mother and a baby, and it covered only normal and cesarean deliveries, with specific limits for private hospitals. It is good to note that that cover did not include immunization for the newborn. Honorable Speaker, moving on to renal care. SHA renal care includes the management of chronic or acute kidney failure, such as the 3 sessions of the hemodialysis for deserving patients, 2 sessions of these, and 2 others for the prenatal dialysis. This cover only includes the pre-transplant evaluation, dialysis, kidney transplant, post-transplant care, with set tariffs for each service. That's what SHA covers. Comparing this with the renal care under the NHIF, renal care was limited by sessions. 2 sessions covered per week, hence patients requiring 3 sessions and more were required to co-pay. Dialysis and kidney transplant had also set limits per sessions and a package payment for transplant. From the foregoing, Honorable Speaker and members, it's clear that SHA's renal care package, which is found on our website for all Kenyans to see. The benefits of SHA are open, they are public, they are in our website. Our renal care package is more detailed with specific tariffs and services, and they are tailored to a comprehensive patient care before and after the transplantation. I want to report, Honorable Speaker, with your permission, Kenyatta University Referral Hospital, which we are proud of, has done the first 2 kidney transplant 2 days ago. And a good one where there was no organ harvesting. Honorable Speaker, on mental health services. Mental health is an area that I think our country is not serious about it. And I want to make it a key priority for me under the Ministry of Health. But how does SHA covers, or what does it provide for mental health? SHA provides for comprehensive inpatient service in designated rehabilitation centers from the CAFE level 4 to 6. Additionally, services include mental health education, counseling, psychosocial support, and rehabilitation for those who use substance abuse and who suffer substance abuse disorders. Honorable Speaker, compared with the NHIF package attracted co-payment. They were not paying for anything to do with the mental health. They were asking you to pay. And it had limited coverage in specific contracted facilities for rehabilitation of drug and substance abuse. Honorable Chair, SHA mental health services are broader, they provide more holistic care, and they cover a wide range of mental health issues both under outpatient and inpatient. Let me go to oncology services, which is very critical to our country. Honorable Speaker, under the oncology services, under SHA, the treatment will follow the treatment care plan prescribed by the oncologist in line with the National Cancer Control Program guidelines. So after when we treat you, we still follow you with the post treatment plan. Comprehensive cancer care, including chemotherapy, radiotherapy, surgical intervention, and routine laboratory investigations with specific tariffs will be provided. Under the former NHIF, oncology services were limited in terms of amount and sessions and attracted co-payment. It also only covered radiotherapy and chemotherapy with set limits per session and per cycle. Honorable Speaker, SHA provides a more extensive oncology package with clear tariffs for various procedures, making cancer treatment more accessible and more predictable for our patients. On surgical services, under SHA, SHA will cover pre-operative, intraoperative, and post-operative care, including major and specialized surgeries, with set tariffs for each procedure type. Under the former NHIF, it only covered major, minor, and specialized surgeries, with set packages limits depending on the level of that hospital. The package also attracted a co-payment. To this end, Honorable Speaker, SHA prevents such as extractions, scaling, and management, while NHIF dental services were only limited to tooth extraction. In this regard, dental services are more broader under SHA and includes a wide range of treatment. On the third one, on emergency, chronic, and critical illness fund, Honorable Speaker, under SHA, SHA covers medical and surgical procedures not available locally with a limit of 500,000 per person, whereas under NHIF, a similar coverage through reimbursement for overseas treatment up to 500,000 subject to approval was offered. SHA's structured approach with specific tariffs for different treatments shall ensure better planning and access to necessaries abroad. On emergency treatment, Honorable Speaker, SHA emergency treatment shall be accessible to all Kenyans. Under NHIF, emergency treatment was only accessible to be paid by NHIF members. SHA offers a more comprehensive cover. Critical services, SHA, the critical services include care for admission in intensive care unit, high HDU, and NCIU, unlike NHIF. And all this include even the band units. The critical services were not covered under NHIF. SHA offers critical care package, including specialized services and broader coverage which enhance the safety net for health conditions. Honorable Speaker, under SHA, that's emergency evaluation, SHA accidents. Under SHA, accidents and emergencies are paid for all Kenyan residents under the Emergency, Chronic, and Illness Fund. Under NHIF, emergency evaluation was limited to road ambulance service through contracted providers like Kenya Red Cross. Honorable Speaker, let me say this very clear, and many people don't know. And members have been aware that in the event you are walking in the streets and you get a stroke or you get an ailment, when you are rushed to a hospital, the first thing they used to ask you under the former NHIF was deposit. Under SHA, under the emergency, you are rushed to a hospital, that hospital will admit you, will treat you, and will release you out, and you don't pay anything. You even don't need to register. And I'm sure many members will agree with me that there are many Kenyans who die when the ambulance is going around looking for a cheap hospital that can take a lower deposit. These SHA benefits Now, for emergency, chronic, and critical illness fund, we'll make sure that in any emergency, any hospital must admit, treat, and release that Kenya. And I want to assure this House that if any hospital will do contrary to what SHA provides and the law you have passed, I will have no other reason other than to close that facility. Honorable Speaker, in summary, I think the member has the key achievement of SHA benefits. These benefits are found in our websites. Kenya has made largest step in achieving of universal primary health care service for all Kenyans, and it's important to know that 70% of the health burden are at the primary care in nature. They are at our villages. They are in the rural part of Kenya. And that's why this House and government decided that the primary health care must be free. We have a comprehensive coverage. Under SHA, you have more inclusive, more detailed benefit package. It covers a wide range of medical conditions, procedures, and services compared to NHIF. The SHA structured tariffs, they are structured. SHA provides clear tariffs for various services. It has enhanced transparency and predictability for members when assessing the healthcare services. Number 4, Honorable Speaker, user-centric policy adjustment. SHA includes specific benefits and processes such as re-registration of members and structured penalties. Honorable Speaker, even we are focusing more on preventive care. SHA emphasizes on preventive care, including health education, screening, early detection, aligning with the long-term health outcomes. We must, before we were dealing with the other aspect, but this time SHA says it's focusing on preventive. And then lastly, and second lastly, better access to specialized services. SHA gives you more specialized care options, such as mental health care services, oncology, renal, providing members with a better access. We are also have a comprehensive emergency and critical care. Honorable Speaker, on the question of the justification for the mandatory migration of NHIF contribution to SHA and any other measures put in place. Honorable Speaker, if you agree with me, when I was looking at this question, I asked myself, why should I answer? Because it is this House that created the law of Social Health Authority Act and Social Health Insurance. And in the transition clause, what you are doing, you are making NHIF redundant. So at that stage, you should have asked, why are we transiting? But because I have to answer questions before the House, I have to do it. Yes, I have to do it. But now that I am on this side, I think Honorable Jende should have, Senator Jende should have asked this question when we were passing the bill, and now which is an act. But Social Health Insurance Act repealed the National Health Insurance Fund. And with the repeal, all the obligation and assets of NHIF were moved to Social Health Authority, as provided for in the Social Health Insurance Act. And the effects of paragraph 2 and 3 of the first schedule to the Act 23 was to vest all these assets, rights, duties, and powers of NHIF in the authority, which assets include NHIF database. So therefore, Honorable Speaker, to ensure that timely and seamless access to health benefits of the beneficiaries of the defunct NHIF, the authority mandated through a legal notice number 147, published on 20th September 2024, for the transition of members of the National Health Insurance Fund, including our honorable members here, under the repealed NHIF Act. They all transited to Social Health Insurance Fund upon verification of their data by the authority using existing relevant database. Honorable Speaker, the information was transferred to ensure that all these members and their declared benefits can access benefits come 1st of October 2024. The transition of the information was in the interest of the members. Secondly, Honorable Speaker, Section 28(2) of the Data Protection Act provides that data may be collected indirectly from the data subject, where collections from another source could not be prejudiced in the interest of the data subject, where the collection data from another source is necessary. So, Honorable Speaker, if I go to the question that the Senator sought clarification on the measures put in place to guarantee comprehensive year-round.
CS, have you concluded with the two questions by agenda?
No.
Because of time, I would prefer that you move a little bit faster.
Honorable
because we already
Speaker,
have the responses.
Honorable Speaker, you know the Senate.
And also, yes, I was actually having difficulty to follow your response because we don't have that additional information you're giving.
Honorable Speaker, this document I photocopied, I have signed, and I have given to the House, to the relevant House, to the Senate, and some members have.
Cabinet Secretary, I'm being informed. Cabinet Secretary, order, senators, order. Cabinet Secretary.
I can leave this also with the House.
Cabinet Secretary, I'm being informed that you actually signed this response that you have when you were in the House.
Yes.
So it has not been distributed. So what we'll do is we will stop where your response is, that the copy we have, and go to the supplementaries, and maybe that issue will come up.
But Honorable Speaker.
Honorable Senators.
Honorable Speaker, for your guidance, and I abide by your ruling, the House has 3 different methods. The House can call me to a committee. The House can tell me to send a written statement to the clerk. And the House can tell me to come to the plenary. And now I've been told to come to the plenary, and it will be very unfair if you cut me short. And I'm not only talking to the senators, I am talking to the people of Kenya through you. If you allow me to finish the question, and then maybe I take the supplementary. I don't know whether the Senate is in a hurry, but me, I'm not in a hurry.
Cabinet Secretary, we are not in a hurry.
Yes.
We are just running out of time.
So,
and there are 2 more questions for you to reply to.
I can take the next 2, and then I can give.
Yes, and then.
Because I've covered a lot of the questions of Honorable Senator for Kisumu. I can give him this copy.
Yes.
And then I go to the other questions and the supplementary.
Let us do that, Cabinet Secretary. Thank you very much. Honorable Senators, we are going to take supplementary questions from Senator Ojenda. And Senator Ojenda, I think you had informed that Senator Muma will be taking one of your supplementary questions.
Thank you, Mr. Speaker. Mr. Speaker, because I'm a loyal member of my party, I have donated...
Senator Ojenda, just one moment. Take a seat, Senator Ojenda. Take a seat. Before your point of order, Honorable Senators, I would like to acknowledge the presence in the public gallery this afternoon of visiting teachers and students from Ithumale Secondary School in Makueni County. The delegation comprises 2 teachers and 48 students who are in the Senate for a 1-day academic exposure. In our usual tradition of receiving and welcoming visitors to our parliament, I extend a warm welcome to them, and on behalf of the Senate and on my own behalf, wish them a fruitful visit. Thank you. Yes, Senator Bodukalwale, what's your point of order?
Speaker, as you'll notice, we are all straining to follow the proceedings. And Mr. Speaker, I've consulted the Sergeant at Arms. That noise you're hearing is from doctors, clinical officers, and other members of the Universal Healthcare, UHC. Mr. Speaker, could you resort to standing order number 1? You suspend the sitting for 5 minutes so that we can go and receive the memorandum. Hand over to the minister since he's now here. He has deliberately, Mr. Speaker, refused to talk to those doctors. And that's why they have strategically come when he's here, so that then we can hand over to him and interrogate. If need be, you order him to go and receive that. Both exits are blocked.
Senator.
Mr. Speaker, sir, before, Mr. Speaker, Mr. Speaker, in conclusion.
Order, Senators, let's listen in silence.
Mr. Speaker, in conclusion, you recall on the 25th of June, that is how the National Assembly continued ignoring. As people pushed, they were continuing to vote. Let us respond to the public, hear them out, so that for the first time, we capture the minister for these members of staff who have found it impossible to get in this.
Order, senators, order. Order, senators, we are running out of time. Senator Boni Khalwale, although you're raising a valid point, we are not voting on any matter today. You can ask your staff at your office to go and receive the memorandum, or you can go receive the memorandum and come and put the question to the CS here. So Senator, yes, Majority Leader, what's your point of order?
For 10 seconds, on issue of procedure, Mr. Speaker, yesterday at SBC, we passed an agreement that whenever we are handling this session and we are pressed for time, we give priority first to members that initially drafted questions before supplementary questions. I wanted to request, given how much time is spent, that you kindly bear with us. Even previously with the other ministers, that's what the speakers, the substantive speaker did, that you allow the two members who had questions to finish their questions. The minister responds. If there is time left, Mr. Speaker, I would humbly plead that we do supplementary questions. And also, Mr. Speaker, I don't know who shared out my number, but I have more than 1,000 messages from UHC staff who want specific answers from the minister. It will be unfair if he leaves the House today before addressing himself on these issues of UHC. So I plead for your indulgence.
Thank you. Thank you. No point of orders. No point of orders. Senators. Senator Cheriot, I think we will proceed as you've requested. It will save us time because we're really running out of time. And I wish we would stop all these point of orders so that we can manage our time properly. So, Senator Ojienda, we are going to proceed to the next two questions, and then we'll take supplementary questions, all of them at the end.
Mr. Speaker, just on a point, may I then, I will assign my supplementary questions to the Senator for Vihiga for one question, Senator Muma, Senator Faki, and lastly, yes,
Senator Eddie, it's okay. Senator Sifuna, please ask your question.
Mr. Speaker.
Thank you, Honorable Speaker. Although the CS was saying he's not in a hurry, we need to remind him that he came late. And therefore, it is the reason why we are running out of time. And he knows the House rules that there is a time for the rising of this House. Honorable Speaker, I want to ask question number 32. Honorable CS, could you tell us why was the Edu Athia medical scheme, which provided comprehensive medical insurance for secondary school learners under the National Health Insurance Fund, discontinued under the current Social Health Insurance Fund program? And secondly, what are the reasons for the government's failure to provide last expense compensation for Mr. Elias Majau Muta, whose son, Master Robin Murimi Majau, a Form 3 student at Kibera Secondary School, passed away on 9th September 2022. Now, Honorable Speaker, I have looked at the response that the CS has given, and in the interest of time, maybe he can just be brief, and he has asked in the response that I provide certain documents. I would like your clarification or direction, Honorable Speaker, because I have those documents here with me, and I want to put them in the CS's hands. I don't know how that is going to happen, but I will await your direction.
What's your point of order, Senator Eddie?
Madam Speaker, I'm raising understanding order 101, Madam Speaker. I mean 101 and standing order number 1, Madam Speaker. Madam Speaker, what Senator Boni Khalwale has brought in this House, Madam Speaker, and requested your chairpersonship to rule on is a critically important one, Madam Speaker. As we are speaking right now, Madam Speaker, the healthcare structure is all in disarray with these strikes, Madam Speaker, because of the UHC strikes, Madam Speaker. If they are outside here, Madam Speaker, and this House, we make decisions as senators, Madam Speaker, we are requesting that you adjourn the House for 5 minutes. We go and get those petitions by UHC, Madam Speaker. The strike is going on. Healthcare is crippled, Madam Speaker. They're not being responded to. The health minister is here, Madam Speaker.
Senator Eddie, please sit down.
Why can't we just adjourn for 5 minutes we make the decision?
Senator Eddie, please sit down. Order. What you're raising was raised by Senator Duale, and the Speaker on the chair actually made a ruling on that. Senator Eddie, please sit down. It is my decision that we finish the questions and then we will do this. Please sit down. No. Can I invite the CS to answer the question?
Honorable Speaker, I did not send the UHC staff here. I met them
Order,
last week.
CS, can you answer the question, please?
Yeah, I met them last week, and they're here because
Order,
the budget is
CS,
making...
can you answer the question?
And I'll be very happy to receive the petition. Honorable Speaker, I want to thank the Senator for Nairobi. The second question, I think we are done. Give me, I can answer, but give me the documents. But let me just, for record and for the
CS, order, Honorable CS, you are now doing my job. The member requested that I give him an opportunity. Now you're answering on that. Can you just answer the question? Thank you.
I am exactly doing that. I am answering the question number 033 and 034 by the member for the Senator for Nairobi, Honorable Madam Speaker. The Ministry of Education engaged the former National Hospital Insurance Fund to provide a comprehensive medical insurance cover for all students in public secondary schools. This scheme was branded Edu Afia, commenced on 1st of May 2018, and was renewable annually for a period of 5 years, lapsing 31st of December. Honorable Speaker, this scheme was rolled out through the National Education Information System, NEMIS. There are several challenges that were found in that system. Fraud, misuse, double payment were made to health institutions arising from a single treatment. And if the Senator wants those information, I can provide the names and the institutions. As such, it was found to be unsustainable, and the government resolved to reconsolidate all these special schemes into one, the Social Health Authority benefit package. Therefore, Honorable Speaker and Senators, the consolidation of the Edu Afia scheme with all the schemes that were managed by the defined NHIF is geared at implementing the right to the highest attainable standards for all Kenyans, and further, the right of the child as envisaged under Article 53, Sub-Article 1C of the Constitution of Kenya, as read together with Section 16 of the Children's Act, which guarantees every child shall have the right to the highest attainable standard of healthcare services in our country. Honorable Speaker, under SHA, students belong to our household, and therefore they're eligible to benefit from the three funds. Honorable Speaker, on the last part of the question by the Honorable Senator for Nairobi, on Mr. Elios Majau Mlimuta, whose son, Master Robin Murimi Majau, a Form 4 student at Kibera Secondary School, passed away on the 9th of September 2022. May his soul rest in peace. The response is this. The comprehensive medical scheme for students in public secondary schools included a group life, the last experience cover in the case of the demise of the student. To access the benefit, the learner's next of kin was required to fill the last expenses and group life cover claim form, which were available from the school. The duly filed claim form was to be submitted to the Ministry of Education, sub-county, and county offices, which upon verification be forwarded to the Ministry of Education headquarters for second verification, and then forwarded to the defunct NHIF. And I wish to state that SHA, in consultation with the Ministry of Education, have gone through the list of the claims submitted during the 5-year contract period they had, and have not traced the mentioned claim. And I really want, because I don't want to give the benefit just to government, I want the Honorable Senator for Nairobi, in terms of the proposed way forward on this matter, I request Honorable Sifuna to provide the specific details, including the name of the full of the students, the student's name is number, the student's death certificate and burial permit, and the parent's contact, and I will follow up correct guidance on the last expenses claim process with the school and the parent and next of kin. I will do that, and I will bring an answer. I mean, I think I am obligated to do that. Senator, if you provide me with those I have asked for,
Honorable Senator for Nairobi, you can actually come and provide. In terms of protection of the rights of the child, you may not read the particulars of the child. I hope you know that.
Yes,
and then
I
you can
understand
hand
that.
over physically to the...
I understand that, Honorable Speaker. Just for the record, the entire process for the processing of the claim was followed, except the county director has refused to sign the certification by the county director for over a year. So I have the form here that has the details, including the name of the child, the name of the parents, and the contact of the parents. I have the form which they filled for the claim. I have the ID of the parent. I have a letter from the school. I have the certificate of death and indeed the permit for burial. Honorable Speaker, I wish that I table this so that the CS can receive it.
Please table it.
Thank you.
And Secretariat hand it over to the CS. Senator Manzo for the next question.
Thank you, Madam Speaker. This is my question to the Cabinet Secretary. A, could the Cabinet Secretary provide a detailed breakdown of the management and utilization of the Tobacco Control Fund, specifically outlining how funds have been received and allocated as stipulated by Section 7 of the Tobacco Control Act 2007. B, could the Cabinet Secretary provide information on the measures the Ministry has put in place to improve transparency and accountability in the administration of the Tobacco Control Fund, and how it plans to address the recent assessments indicating insufficient progress in advancing tobacco control efforts in Kenya in light of the influx of oral nicotine pouches, e-cigarettes, and such other products targeting the youth and children. C, in light of the 2015 court case under petition number 143 on the constitutionality of the tobacco control regulations, could the Cabinet Secretary provide details on how the Ministry has ensured compliance with the regulations, particularly regarding the solatium contribution from tobacco manufacturers and importers? And D, how is tobacco control being coordinated with the Ministry and across the country, especially in the context of devolution, Madam Speaker? Speaker, with your kind permission, the answer was not in the bigger pile of answers which came in earlier. And while here, I've just seen annexures which have come out, but I'm ready to be guided by you, the Speaker, and the Cabinet Secretary. I thank you, Madam Speaker.
Cabinet Secretary.
Madam Speaker, let me on the onset say this is a very complex matter, and it's a matter I am dealing with, and it has many faces. So if the House will not be very happy with the answer I have been provided, I am ready and willing to come back next week, because my conscience is 50-50, So this house will help me. But let me just read what the ministry officials have given me. There are many, many issues I'm being asked outside there on this tobacco thing. Honorable Chair, the Ministry through the State Department of Public Health and Professional Studies oversees the regulations of tobacco products as stipulated in the TCA Act of 2007 and Tobacco Regulations of 2014, which is implemented by a body called Tobacco Control Board and the Division of Drug and Substance Control within the Ministry of Health. The Tobacco Control Fund, known as TCF, was established under Section 7 of the Tobacco Control Act, as the member have said. It's financed through parliamentary appropriation, forfeited properties, voluntary contribution, and mandatory solutium contribution from tobacco importers and manufacturers in our country in order to facilitate tobacco control initiatives, including research. The fund resources are supposed to be used for research, for public awareness campaign, for cessation programs, for enforcement activity. Currently, the solutium contribution remains the primary funding source, while efforts are ongoing to explore and implement additional funding streams. The fund is administered by the accounting officer or appointed official pursuant to Section 8 of the Act, and that is to ensure efficient allocation and utilization of resources. According to the records, in the financial year 2024-2025, an allocation of 831 million has been approved, and the annex is what we have provided for supporting the following key activities, both recurrent and development. There is a capacity building and nationwide public awareness. There is ongoing research application calls to inform evidence-based. There is the formulation of the monetary and evaluation framework. There is the establishment of the treatment and rehabilitation of centers in the 10 most affected counties: Nairobi, Nakuru, Mombasa, Laikipia, Kakamega, Eldoret, Meru, Machakos, Kisumu, and Kericho. There is the element of sensitizing healthcare workers and provide health product technologies, meanwhile as the process of tendering the putting of the infrastructure. These funds are also to be used to review the Tobacco Control Act. I am aware that a draft amendment bill is under the stakeholder validation. There is execution of the surveillance and enforcement, including multi-agency raids on shisha dens and successful prosecution. And Madam Speaker, I think, let me be very candid. I think Parliament must define what is multi-agency. This multi-agency thing, even when I was the leader of majority, is abused. It must be defined in law. Somebody just sits somewhere, he picks few, 5, 10 people from different agencies, and he tells you multi-agency. No, I think this country can do better. So Parliament must define what multi-agency is. Multi-agency is important, is key, particularly in the security sector. And the ones in the security sector have been defined. But you know, you can't walk to Ministry of Health or Ministry of Education and you say, on this matter, we will have a multi-agency. No, no. I think Parliament is the powers of lawmaking. We must define what multi-agency is. Otherwise, multi-agency is not in law. I mean, it's not been there. Nobody can tell me it's in that act. And this multi-agency thing started during the time of President Uhuru Kenyatta, and I think it should not. Parliament must talk about it. There are areas like the security sector.
Okay, I thought you might want to bring it in your supplementary question. Okay, proceed.
To get to that, Madam Speaker, it is good that the Cabinet Secretary was very honest with what he said, and as I sit here, and as I present, Madam Speaker, documents are still coming to me, of which I need time to go through.
Senator Manzo, please sit down. That is, what we are doing is unprocedural. Let the CS finish, and then if you have anything additional, you will bring it in your supplementary. CS, have you finished? Please finish.
Chair, that's why I said this thing of tobacco is very complicated. So what are the measures that are used for transparency and accountability? To enhance transparency and accountability, the Management Tobacco Control Fund. The Minister has developed an operational manual guideline in 2022, and audits are conducted as per the Public Audit Act. Chair, let me not lie to this House, and I agree with the Honorable Member. I have not seen these guidelines. You know, I have not seen these guidelines. And I want to go unanswered. And then in terms of the dedicated Tobacco Control Fund Implementation Secretariat, it manages the day-to-day operations, maintains financial records, and ensures regular reporting too. But I think the House should not worry because I am on it this thing. It will either straighten up or it will fold. It cannot be business as usual. It's one of the things which are on my table. Many things, including a letter from the DCI on inspection. So I'm studying that. But because I had to come to the House, I had to find a way. So I'll talk to my PS and the people concerned, and we must speak to the people of Kenya on what is going on.
Honorable CS, can you just hold on for 1 minute?
So I will.
Honorable CS.
Chair, can I ask you?
I'm just requesting you give me 1 minute. Sit down first. Honorable Senators, in view of the interest by Senators in the matters currently under consideration, I direct that the Senate extends today's sitting for no more than 15 minutes pursuant to Standing Order 34-2A. Proceed, CS.
So, Chair, I think this, I will ask you, Chair, that this tobacco thing, with the analysis of the member who asked me, I be given more time to find out and even come with the Auditor General's report on this fund and all the story behind it, because even me, I have not really digested and internalized this thing, and I don't want to cheat the House because I am unanswered. Tomorrow the same House can hold me to account. If I seek the approval of this House, I will be told I have said this and this. So can we, with the indulgence, can we step down this tobacco thing? I can still ask, if the members want to ask questions, I can take the notes, but I think this tobacco thing I need to find out what's
Thank you, CS, for being so frank. And in fact, a member was going to ask for some annexures that you've not brought. Members, I suggest that this is a serious issue. We step down that question and allow the CS to provide a comprehensive response. In this House, CS, you'll want to know that I think even before the House, there is a bill that deals with tobacco control. So I think the House would want majority.
Speaker, I beg your indulgence because I have additional request still on this tobacco issue to the Minister, and there's something that he has alluded to. This, can I just make it as a request so that as he brings additional information to the House,
That is fine. That is fine, your Majority Leader.
There is something is not right at the Tobacco Control Board, and I'd wish that the Minister listens keenly to this request. And I like the fact, Madam Speaker, that the Minister has actually alluded and spoken on this thing called the multi-agency. As representatives of the people, we sometimes come into contact with information that is useful for Cabinet Secretary to know. I know for a fact that there is a certain dispute that exists presently before a tobacco importing company and this board. A company that went through all the legal procedures, paid their taxes, then somehow one day, one afternoon, this so-called multi-agency that the Minister is speaking to show up at their warehouse, confiscate goods, goes to the Department of Public Health, falsifies documentation and claims that there is some drug and substance that is in the products that this company had imported. Therefore, putting into question so many other agencies that had prior approved those products to be on the shelves of this republic. That matter has been investigated by the DCI. I am aware that they have filed a response back to the ministry, and they have confirmed that that multi-agency actually misled the country. I would wish that when the minister comes back to this house, they bring the findings of the DCI with them and tell us what will be done to those officers that led this kind of cartel-like operations where we can use government agencies to falsify records on health matters. I thank you, Madam Speaker, for indulging me.
Secretariat, I direct that this question be rescheduled with all the aspects that have been raised by the members. We now move on to the supplementary questions by those who submitted the questions. Senator Manzo, do you have a supplementary question? Oh, no, you are, sorry. Yours is not there. So I don't see Senator Sifuna, neither do I see Senator Ojenda had actually delegated to Osotsi Faki, Senator Faki.
Asante, Bi Speaker. Waziri, asante kwa ujio wako asubuhi ya leo. Na swala langu ni kuhusiana na malipo ya SHA. Kwamba inakuwaje wakati mgonjwa kwa mfano anafanya operation, SHA inasisitiza kwamba lazima alipe malipo ya zaidi ya miaka 2 ndio aweze kupata huduma ambayo anahitajika kupata, either ya operation ama ya kulazwa kwa matibabu fulani ambayo ni ya kitaalamu. Hiyo imeweza kufanyika kwa sababu nimepata malalamiko mengi kutoka kwa wananchi kwamba wanalazimishwa kulipa zile subscriptions za mpaka miaka 2, miaka 2 na nusu ndio waweze kupata huduma hiyo kutoka kwa hospitali zao. Asante Mheshimiwa Speaker.
We'll ask a number before you answer CS. Senator Oruoba.
Thank you, Madam Speaker. Madam Speaker, I have a concern, a question about Linda Mama. Waziri, I know you mentioned and elaborated about how Linda Mama has been absorbed into the bigger cover. Waziri, I've had the privilege, or is it the advantage, of being pregnant in this particular transition. And I don't know whether you know that that comprehensive cover that you are saying is there for Linda Mama, or that covers prenatal and postnatal, actually doesn't exist in totality. Waziri, I'm not sure if you are aware that some of the prenatal services that you have quoted are not given under that comprehensive cover. For instance, scans are not covered. A pregnant woman requires a minimum of 2 scans before they give birth. That is not covered in the cover that you are talking about. Also, when you have postnatal, and my question is...
No, you only ask one question, please. Can we move to the next person?
But I've not, Madam Speaker, unless you are going to answer the question, you are going to ask the question. I've not asked it.
You are supposed to ask a question.
I have not asked it. You have asked. I have not asked the question. Madam Speaker, allow me to ask the question.
Okay, proceed.
My question is, Waziri, my question is, have you actually given a service charter under this comprehensive prenatal and postnatal care so that we can be able to tell you, those of us who have been pregnant, which services are being given and which services are not being given? So that is my question to you, Waziri.
Yes, yeah. Order, Senator Oruoba, please. Senator
Madam Speaker, my supplementary question is pretty much interlinked with the first question that was asked by Senator Sifuna, and is on the UHC workers, Madam Speaker. And Madam Speaker, my question is very simple, but I don't want wounding answers from the CS. Because the question is, what is the CS doing to resolve this crisis and strike that we are seeing with the UHC workers in the context, because in the context of number one, making sure that if the CHC workers were going to be transferred to counties, there is harmony of them being put into the payroll nationally, the same way we have seen with community healthcare workers on the portion that the government takes care of. And number two,
only one question. Senator Eddy, please. Senator Eddy, please sit down.
Madam Speaker, allow me just...
Senator Eddy, I have ruled. Please sit down. No, it is one question, and you have asked it. Senator Miraj, please. Okay, proceed.
I beg your indulgence because the reason why they're striking is very important. The second part of this, Madam Speaker, is that there is budgeting process going on right now for these UHCs. Why they are rioting is because...
Please ask a question.
So the question is the CS going to make sure that they are put into a permanent and pensionable program in this budgeting cycle? Thank you, Madam Speaker.
Senator Miraj.
Asante, Bi Speaker. Swali langu kwa waziri litakwenda moja kwa moja kama mkaazi wa gatuzi ya Mombasa. Tuko na faraja ya kwamba sisi tuko na referral hospital ya Coast General. Lakini tatizo ambalo linaendelea pale kwenye hospitali yetu, Bwana Waziri, ni kwamba wagonjwa wananyimwa huduma. Wananyimwa huduma hivi ya kwamba wanapofika wanaulizwa maswala ya kwamba kama
Senator Miraj, ask a question please.
Si ndo najieleza tafadhali.
Uliza tafadhali.
Swali langu ni kwamba kuna ushirikiano gani wa karibu baina ya wizara na gatuzi ya Mombasa, kwa sababu anayepeana huduma pale CEO anasema ya kwamba hamupeani pesa za SHA wanapotibu wagonjwa. Kwa hivyo wagonjwa ambao wana uwezo wanalipishwa pesa zaidi. Bill zimekuwa kubwa, radiotherapy haifanyi. Yani Mombasa, waziri, kama ingewezekana, mimi kama mwakilishi kutoka kule, naomba ufike Coast General. Maafa yamekuwa mingi, hakuna manasi. So,
you have asked the question. You have asked the question. Now you are
ushirikiano gani wa karibu?
Order, Senator Miraj. Honorable Senators, I would like to acknowledge the presence in the public gallery this afternoon of visiting teachers and students from Kiburu Boys High School. Order, Senator. A boys' high school in Kirinyaga County. The delegation comprises 3 teachers and 49 students who are in the Senate for a one-day academic exposition. Honorable Senators, in our usual tradition of receiving and welcoming visitors to Parliament, I extend a warm welcome to them, and on behalf of the Senate and on my own behalf, wish them a fruitful visit. Thank you very much. Senator Kavindu.
Thank you, Madam Speaker, for giving me this opportunity to ask my question. And I first of all start by congratulating Honorable CS for coming and appearing before this Senate, because many of the times people are called, CSs are called and they don't appear. Honorable CS, my question is, what are you going to do about networks in the hospitals? Because this SHA registration is really a big problem. People
Senator
are waiting
Kavindu,
for it.
I would like you to ask a question, please. Ask the question.
Sinauliza swali, siungoje.
Senator,
Sasa tutaharibu wakati. Siwacha nimalize.
Senator, please follow the rules. Just ask the question.
Yeah, the question is, patients are staying at the hospitals from morning to evening until the next day, being told that they cannot be treated because they cannot access SHA. So, and again, Honorable CS, you said that SHA is free. These patients are charged 500 to be able to register in hospitals. And
Senator Kavindu, you have not asked any question. And your time is over.
Nimesema bwana
Senator,
Madam,
be consistent in the...
Nimeuliza atafanya nini kuhusu network za SHA, maana hazifanyi kazi. Hiyo si swali.
Now you have asked the question.
Nimeuliza hivyo hivyo.
Senator
Ama
Kavindu,
Kiswahili ndio inaingia.
Senator Kavindu,
wacha basi niulize.
No. Senator, can we move on to
na
the
watu
next
wanalipishwa 500 kuregister SHA.
Senator
alafu
Mandago, please. Senator Kavindu, please respect the chair.
Madam Speaker, before I ask my supplementary question, allow me to table in the floor and the table of the Senate a petition. Madam Speaker, allow me to table in a petition by UAC staff, Madam Speaker, on the issue of confirmation.
Order, Senators, let's listen, please.
On the issue of confirmation of UAC staff. This is a memorandum of objection of the resolution made by the Ministry of Health and the Council of Governors on universal health coverage staff, Madam Speaker. Madam Speaker, by way of memorandum, we wish to bring to attention the grave violations of administrative injustice.
Order, Senator Mandago. This is question time. It's not time for tabling petition. You will use the normal process for tabling the petition. I now want to invite the CS to respond to the questions.
Then
please.
allow me to ask my question.
Okay, ask a question if you have a question.
Madam Speaker, I would like to know from the Cabinet Secretary whether in his budget-making process proposal he included the funds for confirmation of UAC staff.
That's
in
a good
counties.
That's
Madam
a question
Speaker.
now.
And Madam Speaker, now that you have ruled, make sure before we leave this house, you also address those members of UAC, plus the Cabinet Secretary.
Senator Halwade, a question, Senator Halwade.
Thank you, Madam Speaker. Madam Speaker, the foundation, backbone, and engine of the success of SHA, SHIF, UHC is the human resource. Mr. Speaker, I rise.
Madam Speaker, not
Madam
Mr.
Speaker.
Yeah.
Under the provisions of our Standing Order 51C, 6C, that the minister be allowed to make a statement on this issue of women resource, because as we speak now, Mr. Speaker, in Kakamega, the doctors are not in hospital, and 17 other counties, doctors are on strike. And Kakamega is special, Mr. Speaker, and Machakos, Madam Speaker, because those two hospitals that are used as centers for training intern medical officers. These intern medical officers have missed out in their program a whole 4 weeks. It's going to affect their qualification as doctors. Could the minister address this issue now?
Honorable Senators, questions have been asked by members, and we have hardly, we have 17 minutes to go. So my view is that we allow the CS to answer. Now you're making it difficult for what Senator Halwale is asking to be accommodated. No, if you ask, then what Senator Halwale wants to do cannot be accommodated. So okay, I'll then make the ruling that we use this time for the question time, Senator Halwale, and the CS, when the CS comes back, one of the things he must do is to address it. Senator Eddy, I have ruled. I have ruled. You cannot have your cake and eat it. I have ruled. Senator Beatrice.
Thank you, Madam Speaker. My question is straightforward, Madam Speaker. Bwana CS, with the establishment of the 3 health funds under SHA, how do you ensure that patients will not be lining up at chemists to look for drugs that have been prescribed in hospitals, because that has been a big problem. We see women lining up with children from hospitals. They are not able to get drugs in hospitals, and so they have to go and procure drugs
Senator,
outside.
you
How
have asked
does
your question.
this address this problem?
You have asked a question. Senator Dulo?
Thank you, Speaker. Waziri, there are some dispensaries within our counties that have stalled under Equalization Fund. I have 2 of them in my county, one called Akadeli and one called Shambani. Those dispensaries were constructed way back in 2019. Even after the ruling of the court case to pay the contractors, I'm asking. Waziri, those dispensaries are vandalized and the counties are passing back to the national government. Are you aware of the same? Thank you.
Senator, what is your point of order, Senator Eddie?
Madam Speaker,
What is the issue?
Understand order 1, Madam Speaker. I'm just requesting you that I understand the sensitivity of time, and there are so many questions that have been asked. Through your honor, Madam Speaker, may we postpone all those other questions, but the CS answers
Senator
the question
Eddie,
of
please sit down. Senator Eddie, I have ruled on that question. I have ruled on that question.
I'm not overruling you, Madam Speaker. I'm just
Senator
requesting
Eddie, sit down. You're actually being a nuisance. Senator Cherargei, 1 minute. Order, Senator Uroba. You are not co-chairing with me.
Madam Speaker, if they continue disturbing you, invoke 122. Standing 122. Madam Speaker, could I ask the Cabinet Secretary?
Senator Eddie, can the Sergeant at Arms escort Senator Eddie out?
Madam Speaker, can I ask? Can I ask the
Proceed,
question?
Senator.
Madam Speaker, thank you. Could I ask?
Order, Senator Eddie. Order, Senator Eddie.
Could I ask the Cabinet Secretary that in light with the court's decision that the verification committee that he formed was unconstitutional and illegal, how is he going to ensure verification of NHIF pending bills and ensure, Madam Speaker, we have both verifiable and unverifiable under NHIF? Because I told Waziri when he appeared that under Article 229 of the Constitution, the Office of the Auditor General should be the one verifying the pending bills. What is his options on the table? And I gave him for free. I didn't even charge him. It was
Senator
pro bono.
Cherargei, please sit down. Before the minister answers, Senator Eddie, please withdraw from the House. Senator Eddie, please withdraw from the House. Sergeant at Arms, pursuant to Sergeant at Arms, please assist in withdrawing Senator Eddie from the House. CS, can you answer the question?
Thank you.
Order, senators, please. Order, senators. Order, Senator Eddie. Honorable senators, pursuant to Standing Order 121, I cite you for disorderly conduct, and I have cited you for disorderly conduct. Senator Eddie, I have directed that you leave the House. The Sergeant at Arms may now proceed to move him out. Senator Eddy, I have directed that you withdraw from the House. Sergeant at Arms, we will not proceed unless you actually escort Senator Eddy out. Please do not defy the chair. Eddy, I am ordering that I'm directing that you withdraw for the remainder of this sitting, please. All the members who are around Eddy, please go take your seats. Take back your seats. Senator Beatrice, Senator Gloria, please go take your seats. Senator Beatrice, Senator Gloria, Senator Kavindu, please take your seats. Senator Korir, what's your point of order? Senator Korir, is your point of order still relevant? Can we listen to the CS, please? Please, let's listen to the CS. CS, please.
Honorable Speaker, the Honorable Senator from Mombasa, Bofaki, I want to assure you that there are no prepayment of 2 years. The SHA Act promotes,
Order, Senators,
provides for 1 year annual payment for informal sector. However, currently, Kenyans who are registering are only paying monthly premiums. On Honorable Senator Fosiolo, we shall engage with the National Treasury and we shall engage with the county governments. Equalization Fund is administered outside my ministry. It's under the National Treasury. It has a secretariat. It is members of parliament, leaders who choose what to do, but I think I will contact the National Treasury and the Council of Governors. Honorable Gloria, there are many, they are covered, in fact, and if you look at the comprehensively, what I have tabled today, you will see it. But further, you need to look at the tariffs of the healthcare service, which was, no, I'm telling you, you need to look at the healthcare service where there was a legal notice number 556 of 225 as gazetted, and it provides for a complete cover. So you go to the benefits. Maybe the facility you went to played a games on it. On Mombasa, Coast General Hospital, on, yes, get us the date and everything, and we'll ask him. On Coast General Hospital, let me first thank the governor of Mombasa. That county is leading in terms of SHA registration at 58, and we must thank him. He has, the person second to him is like the numbers between the numbers for Liverpool and Arsenal. The difference is 10. So that is how he's ahead of the pack. But on SHA pays all approved claims by the 14th of every month. And I will give you the figure. As of today, 228.37 million have been paid since SHA came into place in October. If the claims are not verified, and the governor knows, he talks to his people, I have sent him the bills, he has verified, and he is very comfortable. And tomorrow, in fact, he will be in Nairobi. He will sit with our team on digital health to make sure that his system works seamlessly. Senator Kavindu, SHA registration is seamless you can use the USDD, you can use your phone, *147#. You can use the community health promoters. If they are teenage mothers, which we have a number, we are giving them temporary cards. So it's very seamless. Nobody should. Unlike NHIF, where you need, after you register, you wait for 2 months. SHA is as you go to the hospital, if you register, the system picks you. The only system-related issues, and then if you have any system-related issues, then you call our call center, which is 147, and is available 24/7. And the call receiving is at 0. It was 2 minutes. Now, once you call, in fact, very soon we will call back Kenyans to ask you, why did you call and you dropped the call? That's how it is. I think there was a question on the fund by Senator Beatrice, on the 3 fund under SHA, and the KEMSA. Do we have drugs? I want to assure this House that KEMSA is undergoing a reform, recapitalization. Through the private sector, we are putting about 10 billion to increase their fill rate to 100%. So drugs are available at the last mile. On the doctors in Kakamega and many other places, as Honorable Khalwale was asking this question, I texted the governor of Kakamega. Whether it is true or false, I told him to send me the agreement he has signed with the doctors. He is yet to send me, but he said, I have resolved. There are about 18 counties where doctors have issues, and I have agreed with the union when I was in Mombasa that those issues must be resolved. Kiambu is one of them. And I'm talking to the governors that we resolve. The main issue is on promotion. Consultants, senior doctors have stagnated for a long. But as you know, health is devolved. There is a committee on health here, chaired by by Honorable Senator Mandago. There is a committee on devolution by the Senator of Wajir. I think you'll do much better if you deal with this matter. But on the matter of UHC, Honorable Chair, lastly, the people out there were with me. We have signed an agreement with them, and I am not budging back from that agreement. Because when leaders agree with you, an Honorable Senator, with a light touch, Honorable Cherargei, I will come to answer his question. He's looking at me. It's the last one. But UHC, I've answered you as you are talking to somebody. Honorable Senator. I started with you as I said, Equalization Fund is under the National Treasury. There is a secretariat. It's members of parliament who
Yes, you have under a minute.
Yes, so I have answered that question. So on UHC, the question is budget. Who makes a budget? The budget is made by parliament. I told them, leave my door, come to parliament. Today, this week is a budget making process. You deal with the division of revenue bill, you deal with the county revenue allocation. I'm sure you'll add some money to the counties. Please do me a favor, cut some money, give to UHC. I will pay them. I am struggling. And finally, Honorable Cherargei.
Yes, Senator Kavindu as well says you have not answered her question.
I have answered her question. Maybe she was not hearing.
He has 1 minute. Let him finish.
But let me answer the question of Honorable Cherargei first. And Honorable Chair, as a good friend of mine, he's the last person I will take advice from. He's the last person. I will never take the advice of Honorable Cherargei. Because if I take, I will not even cross the road. But on the pending bills, by law I have established, Kenyans have the right to go to court. They have gone to court. Those who claim those bills, they have to wait until the court makes a determination. I mean, one arm of government has done its job. Another arm of government has injected
Senator Kavindu, quickly.
Senator Kavindu, maybe I can listen to.
No, the question, just say what he didn't answer.
No, Madam Speaker, my question was, registration ya SHA haifanyi kazi. Na hiyo registration ya SHA, the details Honorable CS unanipatia hapa, ingepatiana huko ground ndio watu wajue watafanya nini wakienda huko, si hapa.
Honorable Chair, Honorable Chair.
Honorable Senators, having concluded the business for which I extended the day's sitting, the Senate stands adjourned until later today at 2:30 p.m.